Go.
All right. My name is Corey. I'm going to be doing a dressing change and wound culture on Mr. Jones. I have my supplies ready. I've checked the doctor's orders, and they do indeed say to do this culture and dressing change on Mr. Pat Jones here. So I'm going to enter his room. Hello, Mr. Jones. My name is Corey. I'm going to be your student nurse today, okay? We'll give you some privacy here. What we're going to be doing today is we're going to be doing a dressing change and a wound culture on you, okay? Can I get your name and date of birth?
32086.
Okay, Pat Jones, 32086. Perfect, it looks good. All right, Mr. Jones, are you allergic to any adhesives or tape or have any other allergies that you know of? No, you don't?
Sir.
Perfect. Okay, so I'm gonna perform hand hygiene. And we're gonna get that dressing off you, okay? And we're gonna culture your wound before we put a new dressing on you. All right, Mr. Jones. If you don't mind, I'm gonna put this bag, it's clean, but I'm gonna put this bag down by your feet. That way I can just throw away the used stuff as we go. Is that okay with you?
Yeah, that's fine.
Perfect. Okay, I'm gonna set it just like that. So I'm gonna expose your belly here and check out your wound. How you feeling? I see that we gave you some pain meds about 20 minutes ago. Is that helping?
Yeah, I feel good.
Okay, good. All right, so what I'm gonna do is I'm gonna take this tape off. All right. Okay, so I'm gonna take a look at your wound here, okay?
Okay.
So I see his wound. I'm gonna notice any drainage or anything like that on this pad, any foul smells, anything besides blood basically, and even excessive amount of blood might be a sign of something wrong, okay? So I'm gonna throw that away, and then I'm gonna pull this gauze out, okay, Mr. Jones? Okay, and I'm gonna look at this gauze for any mucus or anything abnormal, any abnormal clotting or anything like that. Okay, how you feeling?
Good so far.
Good so far? All right, so now what I'm gonna do is I'm gonna culture the wound. So I have Mr. Jones's culture swab here, it has his name and date of birth on it. And I'm gonna pull the swab out. Name, date of birth, doctor's orders, all the things that it needs. So I'm gonna swab all around here. Okay, Mr. Jones. Is that okay? Feeling all right?
Yep.
Okay, so this is gonna go to the lab after we're done here. Okay, so now what I'm gonna do is I'm gonna get rid of these gloves, perform some hand hygiene. I'm gonna put some new gloves on. Easier said than done. All right, Mr. Jones, now what I'm gonna do is I'm gonna measure your wound, okay? And see, make sure we're getting smaller and healing up okay, all right? So I measure the root wound, it's about 13 centimeters in length and about 2.5 centimeters in width. Now I'm gonna measure the depth with a cotton swab here. Go to the bottom of the wound, to the base, and it's looking like about 2.5 centimeters in depth. Okay. So now what I'm gonna do is I'm gonna do another glove change. Wash my hands, and I'm gonna clean your wound now, okay, Mr. Jones? So I'm gonna make sure to remember the measurements in the wound and then chart. open this using sterile technique. Okay, I'm gonna pour some water in it, some sterile water. Okay, very good. Hand hygiene. I'm gonna put on some new gloves. While I'm here, I'm actually going to open my abdominal pad. Since I've got things open here on the table, I will need this before too long. Okay. So what I'm going to do is I'm going to take one, wring it out, wipe Mr. Jones off here. Wring it out, wipe the other side. Wring it out, and wipe down the middle here. Okay, now what I'm gonna do is I'm gonna do hand hygiene again. Put new gloves on. Can't have too many clean gloves, right? Okay. Okay, now I'm going to pack the wound. So I'm going to take the gauze here, wring it out. I'm going to twist it up. Okay, then I'm going to insert this in Mr. Jones's wound, making sure to touch all the sides. Okay. All the sides of the wound. Okay. Now, I'm going to put an abdominal pad on Mr. Jones to cover and conceal that wound. So I'm going to take the pad, not touching the bottom side of it. Place it over the wound. Okay. Now we'll tape it down. Make sure I don't tape over his hair in a bad way or anything, so not to cause my patient too much discomfort. And what I'm going to do is I'm going to take this little piece of tape here, I'm going to label it with my name and the date and the time, and that way we know when this dressing was changed last. And I'm going to perform some hand hygiene here. How's that, Mr. Jones? You feeling any better? Good. Some gloves on. So I'm going to get you covered back up. Your wound change is all done. I'm going to get this culture off to the lab so they can make sure you don't have any bad bacteria in there. I'm going to cover you back up, okay?
Sounds good.
All right. Let's fix your gown here too. Go. Okay. Your rails are up. Your bed's in the lowest position. The brakes are on. All your personal things that you might need are here. I'm gonna give you your call light here, okay? So if you need anything or have any pain or anything at all, just give me a holler, okay? I'm going to, this way here. I'm gonna leave my gloves on here for a second while I tie this bag up. So I'm gonna dispose of this red bag according to company policy. And I'm gonna take gloves off one last time. Perform hand hygiene. All right, Mr. Jones, if you need anything at all, okay, give me a call.
Okay, thanks.
All right, we're gonna call it a day.